So today we'll be doing a Foley catheter insertion and also sterile gloving at the same time. So the first thing you want to do is you want to compare the physician's orders to the patient's record or plan of care. Once that is done, you gather your supplies and then you go ahead, walk into the room, introduce yourself, identify the patient using 2 patient identifiers. As always, make sure you provide for privacy. Raise the bed to the appropriate working height and lower the bed rail. Also, it's very important that you make sure to assess for any latex allergies due to the fact that some of the materials in the Foley kit can contain latex. And then go ahead and, before you even touch the patient, of course, as always, perform hand hygiene for at least 30 seconds. And then once that is done, explain the procedure. Go ahead and explain the procedure to the patient. See if they have any questions of any sorts. Once all that is out of the way, the next important thing to do is make sure that they are in position. For this demonstration, I only have the genitalia, but you would ask the patient in a female to get into a frog position, which is try to spread out or have them spread out their legs as far out as possible, bent, kind of like, in a birth giving position, something like that, just so this is open enough for you to avoid having the sterile things touch anything around, like the patient's skin. On a male, it's not necessary to prop them up into the frog position. They can just have their legs flat as long as the penis is still visible on top. But once our patient is positioned, and like I said, I already performed hand hygiene, but I'll just go ahead and perform hand hygiene again just to be safe. My patient is positioned and I performed hand hygiene, so I'm going to get my supplies out. Another thing, wherever you place your kit and your supplies, make sure it's a clean surface, since this is a sterile procedure and we want to keep it as sterile as possible. Another tip is bring the trash can in the room close to you, right next to you. That way you don't break sterile field, because you cannot, once you have sterile gloves on and you are sterile, you cannot raise your hands above your head or below your waist. So that way you can just get your trash and just drop it in there. But alright, back to what we were doing. You're going to grab your Foley kit, take it out, drop that in the trash. And then the Foley kit, it has a 1-inch border, so you will have to carefully open this corner by corner. That way you don't break the sterile field, which is the inside. So we grab one corner, just pinch one corner on the outside part of it, fold it out, go ahead and grab the back of another corner, just fold that out as well. Gonna move this a little more over here. Gonna fold out this corner and the other corner. And now everything in here is sterile. You don't want to touch anything unless you are sterile or have sterile gloves. So once this is open, we're going to go ahead and we're going to put on our sterile gloves. So for this part, I would have hand sanitizer right next to me. That way, when I take off these gloves, I'll perform hand hygiene one more time, and then I will be applying my sterile gloves right now. So for the sterile gloves, you go ahead and take it out of the package. Make sure none of these supplies or materials are expired. Make sure that they're still good for use. So for this package, the inside of the package is the sterile part. So the outside is not sterile. That's why you're gonna lay it on its back. But you have to be very careful. Make sure you have good organized space if your tray if possible. So what I'm going to do is I'm going to go ahead, open up these gloves like this. Once you open them, you will see that it indicates left glove is on this side, right glove is on the other side. So as you can see, or well, I don't know if you can see from that angle, but there is also a 1-inch border that applies to the inside of this packaging as well, just like with the Foley cath. So we're going to carefully grab the edges, the tabs, and all you have to do is just slowly and carefully go ahead and just pull them apart, just like that, and boom. Now you have your sterile gloves also ready to go. Like I said, once you put these on, you can't go below your waist, above your head. So remember, we've done our hand hygiene. Now the first thing you want to do is you're going to go ahead and use your non-dominant hand, in my case my right, and I am going to go ahead and grab the outside of the cuff. That's the way it comes packaged. We're going to grab the outside of the cuff. Make sure not to touch anything else, and just slowly, gently slide it on there. It doesn't matter if it's not perfect the first time you put them on, you can adjust it later. It's important that you don't break sterile field. So this glove is now sterile. I will make sure to keep it in the sterile area. Since this glove is sterile, I will be using my 2 fingers, and I will scoop the other glove on the inside of the cuff with these 2 fingers. And then once I grab it, I will go ahead and then slide my other hand into my glove and pull all the way down like that. Now, once it's all the way down like that, make sure you don't put your gloves, don't reach above, and don't put them below your waist. So we have our gloves. Now I can also fix this other glove and interlock, my fingers. So now once that is done, we can go ahead and since this is now trash, we'll just ignore that for now. And then, so now what you're gonna do is there's gonna be, remember, our gloves are sterile now, so we're gonna go ahead and just take this out. This right here is just to keep the patient clean. So you will put the plastic back down. The best way to put this under the patient is using the airplane method. So you tuck your hands under the side that will, still be sterile, not the side that will be under the patient. So then you just grab it and you would just fold it down and just gently tuck it in under their buttocks. Unfortunately, we don't have that kind of visual, but that I would just verbalize it because that's what you would do. And also, I know I just touched this, but that's just in order for the demonstration. But it's one other important thing I want to point out. Since I've successfully put on my sterile gloves, I'm sterile. So, but if at any time anybody breaks sterility or the sterile field, then you would just have to go ahead and apply your sterile gloves again. Because you don't, this is very important. You don't want to get any organisms into the bladder. But yeah, so you would grab the towel that comes in the kit and use the airplane method by tucking your hands under to tuck this under the buttocks, and that way you're still sterile. Over here we have a drape. This drape can be used for male patients, So this this can typically be used. Uh, that way you can just put the penis through the hole that will come cut out for the drape. But since in this case it's a female, we don't really need it. So we're gonna throw this in our trash. Now the next thing we're gonna take out is we have our let's see, betadine. One important thing is that when you do this procedure or explain the procedure, you want to make sure, like I said earlier, assess for latex allergies, but also assess for betadine allergies or povidone iodine allergies, because they go, sometimes people know them by their generic name, so it's best to double check. So you would assess for that as well. So we have our betadine or povidone iodine solution. So I would tear this open, and then I would pour some onto my sterile tray, which I will use in a second here. So I've poured it all out. I will come over here and drop it into the trash. I will set this aside because everything is still sterile. My hands are still sterile. Now, next step is we're probably going to want to grab this tray and move it off to the side. Remember to keep that 1-inch border. We still have our 1-inch borders everywhere, so we're good. So then the next thing you want to do, take out the urine collection cup in case you need a sample. If not, you can throw that in the trash as well. Lastly, what we're going to go ahead and do is we're going to grab our lubricant. Sometimes lubricant will come in a syringe. Sometimes lubricant will come in a packet, like a condiment package. So then what I do with these packages is I just tear off the corner, and what I will do is I'll tear off the corner and I'll insert the tip of the catheter into the package until I'm ready to put it in. Also, we have our 10 cc syringe, which is sterile as well. This is going to be used to inflate the balloon. So I'm just going to go ahead and attach this as well. So now what I'm going to do is I'm going to go ahead and prepare my Foley. That way it's not flopping everywhere once it's time to actually put it in. So you can just pull this off, throw that in the trash. You're going to grab the tip of your Foley, and like I explained a few minutes ago, I would just put it into the lubrication package. So we're going to let that sit there. Now, the other thing that you want to do is some packages come with their own strap or adhesive device in order to secure the Foley. If not, you can use like a posy device, which is basically just wraps around the thigh to secure it. Although when you secure it, make sure you don't secure it on the rubber because it might pull. Make sure you do it on the plastic tubing instead. But yeah, we have our Foley ready, and now what we're going to do is go ahead and clean the patient. As I mentioned earlier, the betadine has been poured there, so we're going to grab our forceps, and then at this point you will have to break sterile field with one hand, and that hand is going to be the one that holds the labias open. So, I would tell the patient that we're about to start, and then I would place my hand here and spread. I would grab one cotton swab, dip it in the betadine, and then we'll start with the outer lips. So remember, you wipe front to back, so outer, and I would throw that in my trash. Dip dip the other cotton ball in betadine, outer again, front to back. Another one. Now we're gonna do the inner. So inner, front to back. Inner, front to back. And the last one, but the last of the betadine, front to back, down the middle. Okay, so we're done with that. You can dispose of that in the trash, but still, this is still sterile though. So, at this point, you will go ahead, grab your Foley, take it out of the lubrication package, and then just tell your patient to take a deep breath. And then at this point, you will secure it with your hand and just tell them to take a deep breath and just go in, go in, go in, go in, go in. Then at this point, once it's in, the sterile section of this checkoff is now complete. But we're not done here, okay? So once that's in, what you're gonna do is you're gonna grab your 10cc syringe and go ahead and just inflate the balloon. You want to get all 10 cc's of water in there, as well as get them out of there whenever you remove a Foley. So once they're put in, I'll go ahead and show you. You will see this little balloon at the end. I don't know if you can see it from that far, but you see this balloon at the end that fills up. And then you'll just go ahead and just pull it back to make sure that it's secured. Once that is done, we're going to go ahead and secure our Foley. So as I mentioned earlier, if the Foley kit doesn't come with the device to secure the tubing to their leg, then you could use a Posey device to wrap it around their leg. And then you will see, of course, another way to determine that you've done it successfully is you see urine flow start collecting. Usually they come with these hooks, so you can hang it on the side down under the bed. That way it runs down. And then you would make sure how your patient tolerated it. You would, of course, chart everything you did. And then you would make sure you clean up your materials. So I will go ahead and take these sterile gloves off. And then, very important, make sure you wash your hands on the way out. Make sure you wash your hands on the way out of the room. And yeah, you clean everything up, chart or document, see how your patient tolerated it, let them know when you'll be back. Go ahead and put the bed back down, rails back up, and yeah, like I said, wash your hands. Most important thing is wash your hands. But okay, so now that that is done, on a few things that I want to point out. When you do a male, the difference is that for a male, you don't need for them to be in the frog position. Also, when you wipe a male, what you want to do is sometimes instead of cotton balls, you will receive kind of swabs or Q-tip looking things that are already soaked in betadine. So for a male, you go in a circular motion from tip and to the bottom, and you use up all the swabs or cotton balls that come with it. Now, the other part of this checkoff is removal of a catheter. So, of course, in that case, as with any procedure, you make sure you check the physician's orders and compare it to the patient's record. Make sure you have the right patient, identify them with two identifiers, introduce yourself, explain the procedure, see if they have any questions. And then once all that is done, perform your hand hygiene before you touch them for at least 30 seconds. And then I'm going to go ahead and grab my gloves. So I have my gloves. have my gloves. So now that I have my gloves, what you want to do is you get a chuck or kind of like a paper towel or paper sheet under. That way you don't spill anything when you pull it out, in case there's any drainage or any extra urine coming out. Like I said, you already explained the procedure. Wash your hands, put on some gloves, and then what you want to do is you're going to grab a new 10 cc syringe, take it out of the package, and then you're going to connect this to the Foley. Of course, remove any securing devices that were held on there, or like the posy or any adhesive that was in place. That way everything is ready to go once it's out. And then we are going to pull out all 10 cc syringe. There should be all 10 cc 10 cc's, excuse me. You should pull out all 10 cc's back into the syringe. As you can see here, we did get all 10 back, so that's good. I'm gonna set that aside. And then as you pull out the 10 cc syringe, you also pull out the Foley, and you simply pull it out and secure it with your hand. That way it doesn't flop all over the place. So once you pull it out, something that is advised is to hold it, and then you simply wrap it inside your glove. That way you don't get anything on, you don't get any urine or anything on the surfaces or yourself. And then also when you take it out, just check the tip, make sure there's no tears or any debris on the tip, to make sure, just in case, that there's no other things you should be concerned about. And then you would just dispose of your materials again into the trash where they belong, or the biohazard bag for anything that had the urine like that. And then you assess your patient, see how they tolerated that. You of course then clean up. You would put the bed back down, rail back up, call light within reach, let them know when you'll be back. And then most importantly, wash your hands for at least 30 seconds as you go out, and then you go and document everything you did. And that is pretty much it.